Second checks. They're required for most high-risk medications and must occur for all injections, Schedule 8 medicines, and pediatric administrations. We can't eliminate human error, but having two people performing independent checks should mean that there's a very small chance of an error being made. Unfortunately, this practice can be challenging in a complex hospital environment. Let's look at the different factors that can impact the effectiveness of our checking practices. Firstly, there's social and cultural influences. Research tells us that when any process involves double checks, people can become a little complacent. Staff may be less vigilant when they know and trust the person they're checking with. Sometimes, a checker allows their actions to be led by the other person, and they forget to follow their usual rigorous and independent checking process. A big challenge is something called confirmation bias, meaning we may focus only on information that confirms what we're expecting to see. Even non-verbal behaviours can cause another checker to feel they should rush or that they needn't attend the bedside. In some major incident reports, checking staff have even said that they suspected there might be an error but failed to speak up as they thought the other checker knew what they were doing. Sometimes it can be confronting to say, "Oh, I don't know if this is right," especially to someone you respect. Another point to consider is our mental workload. Picture yourself on a busy shift. You're supervising a student, expecting a call back from a doctor, awaiting a pharmacy delivery, and 100 other things when you're asked to perform a second check.
Check, please.
Your amazing brain has a fixed mental capacity, meaning at any moment you only have so much brain power to allocate to holding and processing information. Extreme multitasking is a myth, and when our brains are overloaded, they actually do something called task switching, continually bouncing our attention between different mental tasks. This can happen so rapidly that it feels seamless, but every single switch actually costs us a lot of extra brain power. Then, when we exceed our mental limits, even just for a second or two, some of those mental tasks will be dropped without us even realizing. That's a pretty big concern if you're trying to complete a medication check,
Check, please.
as it means you might go through the motions of checking without critically thinking about each step. If you slip into autopilot mode, even just for a moment, it's extremely likely that you'll miss an error that you would usually have detected. Finally, there's our individual circumstances. Research has proven that personal factors can make us vulnerable to making mistakes or oversights. Across a range of high-risk industries, taking a moment to practice self-awareness has become an important safety factor. So stop and think. Am I hungry? Angry? Running late? Or feeling tired? Am I distracted by nerves, stress, illness, or technology? Remember, to be able to take care of your patients, you must first take care of yourself. Other individual factors include your own personal capabilities and limits. Consider, do I have the knowledge and experience to safely check this medication? Am I confident in how and what to check? Am I familiar with the patient, the protocol, and the equipment involved? It's always okay to stop and ask more questions, and if you're still feeling unsure, you need to find a more specialized or senior staff member to help and teach you. While we continue to make positive changes, our ward environments will always be busy and unpredictable. Staff need to develop resilient safety behaviours within this imperfect system and be aware of how easy it is to become complacent, mentally overloaded, or otherwise vulnerable to making errors. At the end of the day, your patients and your teammates need you to be a careful checker, someone who recognises that if we don't take time to check properly and carefully every time, then these second checks lose their value and become just another interruption. Insisting on proper second check processes doesn't mean you don't trust or respect your teammates, because we're all human and we all make mistakes. The best way to have your teammates back is to perform that second check completely, independently, and all the way to the bedside. So, next time a colleague asks for a
Check, please.
make sure that you both really are ready to check.